Concerns about mental health and depression rising right now due to isolation at home.
We talked with Hawaii Behavioral Health about how they're serving our community without their normal home visits.
We're learning today about the services at Hawaii Behavioral Health, and we're talking to a pair of folks. We want to say hi to Volo and Lori. Hi, you guys. Thanks for being with us on Living in Aid. Appreciate it.
Hi, John. Thank you very much.
Right on. Thank you guys so much. I want to know a little bit about Hawaii Behavioral Health's services and mission. Can you tell me a little bit more about it?
Absolutely. So a bit about us. So we're now the largest outpatient mental health services organization that's actually native to Hawaii. We started in 1993, and our mission is just to help youth as well as older population in Hawaii for people that may have mental or developmental disabilities. We have about 300 staff that includes therapists, behavior technicians, and we service about 500 clients or so. For youth that's been diagnosed with autism, we provide services for them in the school setting, at home, and as well as in our clinic. We also have a partnership with the Department of Health, and we work with them to help clients who are experiencing behavioral health challenges in the community from conditions such as depression and anxiety. And lastly, we have a program that helps people with developmental disabilities. And likewise, our therapists work with them to help them with their daily activities, train them, and help them attain employment, which actually, right now, it's a very critical time given the high rate of unemployment in the state. And lastly, just recently, we formed a new partnership with the Jason Foundation to be able to tackle the problem of suicide in the state. So suicide is actually the leading cause of deaths in Hawaii for ages 10 to 24. And this partnership is formed to educate and to promote awareness for this issue, and as well as to hopefully have prevention as well.
You know, I asked this about just about everybody that's come on the show, every business that's been on our show. I'd love to know how COVID-19 has actually impacted your services.
So definitely it allowed us to learn and grow as an organization, to think of innovative ways to work with the youth and families that we serve. Especially since there's a lot of challenges that have now surfaced with COVID. It gets in the way of a lot of people finding balance and, basically being pono. Right now, we continue to grow and learn as an organization to basically move forward and find more innovative ways and opportunities to serve youth and families in the communities, and not just here on Oahu, but throughout the state of Hawaii.
One of the programs in particular that I would say was impacted by COVID was our autism services program. So through this period, because of little contact kids were able to have with the therapists, they actually lost some of their skills because of the virus and disruption in schools. But luckily what's come out of that is we actually have really qualified staff who are able to address those specific challenges that kids may be having coming out of this difficult period. And they're helping them work on things like communication, language development, improve their attentions, various social skills, memory, academics, and so forth. And as an example, we had a really great success story, is that over the past 6 months, we had a client who went from nonverbal to verbal through this difficult period. So that was really great to see. And we had several other clients where family really felt that they were almost pretty much independent on their own, and that was just amazing to see that improvement in the lives of the kids and their families.
Who would be interested, if one of you could answer, who would be interested in Hawaii Behavioral Health services? And then one step further, how can somebody out there that's watching right now learn a little bit more?
Yeah, absolutely. So we really service both our clients. So for example, if one of your loved ones, your child or family member, has any kind of mental health related issues, they can definitely reach out to us, find more information on our website, or give us a call. But there's other ways to get involved. So if you really care about the community and making a difference in people's lives, you can reach out to us. We have opportunities to work directly with patients of different age groups. Lastly, there's also a program where a family can actually host a child and youth in their home through this transitionary period before they're united back with their family.
Thank you guys so much. That's information we'll have on our website, both the email and the phone number. But thank you both for being with us on Living Into It. I totally appreciate, and I'm sure that our viewers do as well. Thank you so much.
Thank you.
Thank you.
You know, they got a lot of great programs that can help families, help children, and if you want more information, we'll have their link on our website, kh12.com, shortly after the show. Good stuff.
Absolutely, and so many different needs right now, so it's great that they're able to reach out and for people to know that they are there available for support.